Good morning, everybody. My name is Dugan Fraser. I'm an adjunct professor in the Commerce Law and Management faculty at the University of Witwatersrand, where I'm the director of a center called the Center for Learning on Evaluation and Results in Anglophone Africa. I want to tell you about the center, and I want to explain what it is that we do, and I want to tell you why it's so important in the context of COVID-19 that people are able to do the kinds of things we specialize in. So I'm going to jump in at the last part, and I'm going to talk about what it means to be responding to COVID and what we're experiencing as a real challenge for everybody all over the world. And maybe that's what's so amazing about this pandemic, is suddenly everybody is in pretty similar kind of a challenge, although we're experiencing different material conditions and some of us are very privileged. But everybody is suddenly realizing there's a set of skills and capacities that need to be in place if we're going to manage this really, really challenging experience. And so there was a great article that was published on The Conversation, which I assume you all subscribe to, by somebody called Olowale Olayide, who is an academic at the University of Ibadan. And the article argues that there are 6 areas that countries need to be focusing on if they're going to manage the COVID situation well. I'm going to run through those 6 areas with you, and then I'm going to talk to you about what monitoring and evaluation is and why I think it's really an important thing in order to be able to do the things that article says need to be done. So the first thing is that we need proper data and information management systems. And so just to be very practical, in our context, we need to know what kinds of cases are being recorded where and what the outcomes of those cases are, and we need to be able to respond quickly and to lock down certain areas as those flare-ups happen. And to be able to do that sounds easy, but it's obviously really hard to have a system in place that gathers information, that allows us to make a decision about what to do, and then feeds back into the system and tells people how to be responding. And so those data and information management systems are seldom working well. And the work of Clear AA is to improve the institutional arrangements and the skills that people have so that they're able to have data and information systems that work well. Generally, we haven't focused on public health, but public health is one of the kinds of systems that monitoring and evaluation supports. The second thing that the article argues we need to be able to do is to make appropriate policy responses. And that's about using evidence to make good decisions. And so we've been very fortunate in South Africa that our president has been remarkable in demonstrating leadership, in calling for a lockdown very early and flattening the curve. But those decisions need to be based on evidence. And that's not present everywhere. And so to know how to take a package of evidence, develop a response, and make sure that those responses are translated into action is a capacity that requires good monitoring and evaluation. So in order to be able to say, in this place, in this district, in Vembe, or in Rosebank, or at the University of the Witwatersrand, there's been this or that case flaring up. How does one develop a policy response? How do you take action? What is the kind of capacity that's required? And when you build strong, effective monitoring and evaluation systems, you're putting that capacity in place. The other thing that is needed for a very coherent COVID response is local resources and partnerships. We need to be able to know what's present on the ground. We need to be able to know if there are community nodes. We need to know if there are facilities that are functional. We need to know if there are community caregivers. And having the systems in place that allow us to understand what is available and be able to forge partnerships that can provide care and support and that can ensure that people have protective personal equipment. All of those things require information and knowledge that enable us to understand local resourcing and to build strong partnerships. Good monitoring and evaluation is an essential ingredient in all of those things. The fourth thing this article says that we need is that we need strong institutions, especially in relation to disaster management. And the building of that disaster management capacity means, for example, that our local authorities need to be strong, that we need strong Ministry and Department of Health, that we need NGOs that are able to be deployed, and making sure that people have a shared vision, that they've got systems that work. These are kinds of things that monitoring and evaluation can really help with. The other really important thing that the article identifies is the need for leadership, and especially leadership that is respectful of human dignity and human rights, and that understands that human life is a really precious thing. Monitoring and evaluation is a space where leaders are able to flourish. Monitoring and evaluation allows people to identify what's important and to be able to make good decisions. And the last thing that the article says we need for a good COVID response is we need a recovery and sustainability plan. Now, monitoring and evaluation is really the flip side of planning. It's the other end of what goes on. And if we have a good recovery plan and response plan, that needs to be accompanied by a monitoring and evaluation component. So what is monitoring and evaluation, and what does CLEAR do? Well, monitoring and evaluation is two distinct things. It's monitoring, meaning it's about setting up a system for reporting on what's being done, and that entails taking your plan and unpacking it into indicators and targets, and then having a procedure in place that develops reports. Now, that sounds simple, but you know it's not. You know it's hard to develop a thoughtful, analytical, accurate, reliable report. And in order to be able to do that, people often need support. And that's the kind of work that CLEAR AA does. Evaluation is a similar thing, but it's also quite different. Evaluation is much less regularized. It's much less of a managerial practice. It's about sitting down and identifying what questions you need to answer, who needs them answered, and putting in place an exercise that gathers evidence and allows you to make a judgment call, a decision about whether something is good or not good. And that's an area of expertise, and it's something that used to focus exclusively on little projects, but is becoming more and more concerned with systems and starting to understand the interlinkages between various kinds of initiatives. So evaluation is less practiced than monitoring because it's a bit more of a niche area. But the Center for Learning on Evaluation and Results in Anglophone Africa specializes in both monitoring and evaluation. We work with African governments and civil society organizations. We've got a big partnership with UNICEF that involves developing monitoring and evaluation capacity in a cohort of countries. We're based at the Parktown campus of the Commerce Law and Management faculty, and we've got about 25 staff. We also have a partnership with a peer learning network called Twende Mbele, and we are very active on Twitter. If you'd like to know more about our work, please follow us. Also look on our website. There's a repository there that has got a lot of information on our reports and documents, and you'll find it really interesting. If you think we could add value to your process, or you want to know more about what we do, please get in touch. It would be really good to hear from you. Stay safe and stay at home. Bye-bye.